Let me tell you about a patient I still think about. 67 years old, retired engineer, the kind of man who fixed things quietly without making a fuss. He sat down in my office, looked at his hands for a long moment, and then said something that clearly took everything he had to say out loud. Doctor, something changed, and I haven't told a single person, not even my wife. For 8 months, he had noticed that the sensation during intimacy was still there, completely normal. But the physical result he had always expected? Gone, or nearly gone. And instead of talking about it, he did what so many men do. He went quiet. He slowly pulled back from his wife. He started finding reasons to avoid intimacy altogether because the alternative, having a conversation he didn't have the words for, felt impossible. By the time he finally sat in front of me, he wasn't just carrying a physical symptom. He was carrying 8 months of shame, confusion, and a grief so private it had no name. Here is what I told him that afternoon, and here is what I want to tell you right now before we go any further into this video. What your body is doing is not a verdict, it's a message, and messages have answers. My name is Dr. REENA. I'm a board-certified urologist, and for over 12 years, I've been having exactly these kinds of conversations, the ones men rehearse for months before they finally say the words out loud. The ones that feel too personal for a regular appointment. The ones that carry far more weight than the physical symptom alone. Today, we are going to talk about dry ejaculation, what's actually happening inside your body, why it happens, what the warning signs are that you should never ignore, and most importantly, what you can actually do about it. By the time this video ends, you'll understand your own body in a way you probably never have. And you'll feel something that a lot of men in your situation desperately need to feel: less alone. Before we dive in, drop a comment and tell me where you're watching from. Men from every country in the world are part of this community, and every single one of you belongs here. Hit like if you want more honest conversations like this one, and subscribe if you haven't yet, because every week we talk about the things most doctors simply don't have time to cover in a 15-minute appointment. Now, let's get into it. First, what's actually supposed to happen? Before we talk about what changes, I want to give you a clear picture of the normal process, because understanding how something works makes it far less frightening when something shifts. Think of your body's reproductive system as a perfectly coordinated relay team. Your testicles produce sperm. Your seminal vesicles, two small glands sitting behind the bladder, contribute the majority of the nourishing fluid. Your prostate adds its own protective secretion. All of it meets, mixes, and positions itself in the urethra. And at the moment of climax, a rapid, rhythmic series of muscular contractions launches everything forward and out. It is a precisely timed sequence. Nerves, glands, muscles, all firing in exact coordination every single time. Now, here is something that most men have never been told. Something that, once you understand it, genuinely changes everything. Climax and ejaculation are not the same thing. Climax, the intense sensation, the peak of pleasure, is a neurological event. It lives in your brain and your nervous system. Ejaculation, the physical expulsion of fluid, is a mechanical event, driven by a completely separate set of structures. For most of your life, these two things have happened simultaneously, so seamlessly that they felt like one single experience. But they are not. They are driven by entirely different systems. Why does this matter so much? Because it means your capacity for pleasure, the sensation, the connection, the intimacy, does not depend on the fluid. It never did. The pleasure lives in your nervous system, and in the vast majority of dry ejaculation cases, that system remains completely intact. What has changed is the delivery mechanism. And delivery mechanisms can be understood, investigated, and in most cases, fixed. The three main causes. Cause 1, the gatekeeper isn't closing. This is the most common cause I see, and it has a medical name: retrograde ejaculation. Here's the biology. At the base of your bladder sits a small but critically important muscular valve. Its entire job during climax is to clamp shut, firmly, completely, so that fluid has only one available path: forward and out. When that valve is sluggish or fails to close properly, the fluid takes the path of least resistance. Instead of moving forward, it flows backward, into the bladder. You feel the full sensation of climax. But because the fluid never exits, the result is dry. Here is a practical clue that many men notice but never connect. After intimacy, your urine may appear slightly cloudy. That cloudiness is seminal fluid mixing with urine in the bladder. It's not dangerous, but it is your body telling you exactly what is happening. What causes this valve to stop working properly? The most common reason is surgery, specifically procedures on the prostate or bladder. These operations are often necessary, often successful, sometimes life-saving, but they can affect the delicate network of nerves that controls that valve. The surgery does what it needs to do. This is a known, manageable side effect, not a sign that anything went wrong. Certain medications can also cause this. Alpha blockers, commonly prescribed for high blood pressure or an enlarged prostate, work by relaxing smooth muscle throughout the body. That relaxation is exactly what you need for blood pressure and urinary flow. But it also affects that small valve. The medication is doing its job correctly. This is simply a consequence that needs to be understood and addressed. I want to acknowledge something here. Many men I see with this condition had successful surgeries. They recovered well, their health genuinely improved, and then this happened, and suddenly all the relief of healing was replaced by a new worry. That emotional whiplash is real. It deserves to be named. Understanding that retrograde ejaculation is a mechanical alteration, not a sign of failure, not a reflection of your vitality, lifts a weight that is hard to describe until you've watched it happen in front of you, which I have, many times. The practical outlook here is genuinely encouraging. If a medication is the cause, adjusting or replacing it under medical supervision can often fully restore normal ejaculation. If surgery was the cause, specific medications can help strengthen the valve's function. And in cases where fertility is a concern, sperm can still be retrieved from urine for assisted conception. Real options exist, because too, the pathway is blocked. The second cause is less common, but it's one that men frequently miss because it develops slowly and quietly over time. Your seminal vesicles and prostate are producing fluid normally. The manufacturing side is working, but the small ducts, the delivery pipes that carry that fluid toward the urethra, are partially or fully blocked. When those pipes are obstructed, the fluid has nowhere to go. Volume drops, sometimes dramatically, sometimes it disappears altogether. Not because your body stopped producing, but because the delivery system is compromised. What creates these blockages? The most common culprit is scarring from a past infection, prostatitis. A prostate infection, especially one that was severe or undertreated, can leave behind scar tissue that gradually narrows or closes these ducts over years. In some cases, small calcifications, essentially tiny stones, form inside the ductal system and create an obstruction. How do you know if this might be your situation? The signs can be easy to miss. Some men notice a very slow, gradual reduction in fluid volume over months or even years. So gradual, they almost don't register it. Others notice a subtle new pressure or mild discomfort during climax, specifically in the pelvic area. If either of those sounds familiar, pay close attention to that. Here is what I want you to hear clearly. A progressive reduction in ejaculate volume over time is a symptom. It is not aging. It is not simply what happens. It is information, and it deserves to be investigated. The news here is good. Many ductal obstructions respond well to treatment. Anti-inflammatory medications can address obstruction caused by ongoing inflammation. Where needed, minimally invasive procedures can clear the blockage and restore normal function. This is not a permanent condition. Cause 3, the fuel supply is running low. The third cause connects dry ejaculation to something much bigger, a picture of men's health that I want every man over 50 watching this to understand. Testosterone. Most men think of testosterone as the hormone of desire and muscle, but its role in the reproductive system runs far deeper than that. Testosterone is the primary fuel that keeps your entire male reproductive system functioning optimally, including the seminal vesicles and prostate that produce the majority of your ejaculate volume. Here's what happens. When testosterone levels decline significantly, and they do decline naturally with age, though the rate and degree varies enormously between men, the entire production system slows down. The seminal vesicles produce less fluid, the prostate contributes less. The result is a measurable reduction in volume that, over time, can progress to what feels like dry ejaculation. But here is what I really want you to understand. Low testosterone doesn't just affect ejaculate volume. It affects the whole man. The emotional picture often looks like this: fatigue that no amount of sleep fixes, a flatness in mood that's hard to explain to anyone, reduced desire, less reliable erections, a general sense of being somehow less than you used to be, physically, emotionally, energetically. Many men I see have been living with these symptoms for years, chalking every single one of them up to getting older. Some have been told by other doctors that it's just age and there's nothing to be done. I want to respectfully but firmly push back on that. Low testosterone, clinically called hypogonadism, is a diagnosable, treatable medical condition. A simple blood test is all it takes to measure your levels and determine whether they are genuinely deficient. If they are, carefully managed hormone therapy can restore not just ejaculate volume, but energy, desire, mood, mental clarity, and overall quality of life. This is not about chasing the past. This is about making sure your body has the fuel it needs to function the way it was designed to function, at 60, at 70, and beyond. Don't accept diminishment as inevitable. Investigate it first. When to stop waiting and go. Now I need to pause here and speak to you directly. Being your doctor means I have to tell you what I would tell my own father. Most cases of dry ejaculation are manageable. Most have clear, treatable causes. But there are situations where this symptom can signal something that needs immediate attention. If dry ejaculation has appeared suddenly, not gradually, but suddenly, and is accompanied by any of the following, please do not wait for your next routine appointment. Pain during or after climax, blood in your urine or in any fluid, fever or chills, new numbness or loss of sensation in your pelvic region. These combinations of symptoms can indicate conditions requiring urgent urological evaluation. Certain neurological conditions, long-standing uncontrolled diabetes affecting nerve function, and in rare cases, urological cancers can all interfere with the nerve signals and structures that control ejaculation. I'm not saying this to frighten you. I'm saying it because early attention to these warning signs can be genuinely life-changing. The men who come in early have options. Your body is worth listening to, urgently, when it calls. The part no textbook talks about. I want to stop here and speak to something you will never find in a medical journal, but that I witness in my clinic every single week. The emotional toll of dry ejaculation on a man's sense of himself is profound, and it is profoundly underestimated by almost everyone, except the man living through it. Many men have grown up with an unconscious equation in their minds, that the physical evidence of climax is proof of their vitality, their masculinity, their wholeness. When that evidence disappears, something deeper than a physical symptom shifts. Confidence quietly erodes, intimacy begins to feel like a test rather than a pleasure. Men start withdrawing from their partners, not because desire has gone, but because they can't bear the vulnerability of what they fear their partner might think. Exactly like the man I told you about at the start. 8 months of silence, 8 months of slow withdrawal, 8 months of carrying something alone that had a name, a cause, and a solution. I want to say something directly to every man watching this video. Your masculinity is not measured in fluid. It never was. Your worth as a partner, your capacity for intimacy, your ability to love deeply and connect fully, none of that lives in a physical secretion. It lives in you, all of it. The change your body is going through is physiological, mechanical, hormonal, structural. It is not a judgment. It is not a verdict. It is a signal. And signals are meant to be answered, not buried. Talk to your partner, not because you owe them an explanation, but because the silence is costing you both far more than any honest conversation ever could. And talk to your doctor, because in most cases, clarity is closer than fear has been telling you. Your action plan. Here is exactly what I want you to do when this video ends. 1. Don't ignore it. Investigate it. If you've been experiencing dry ejaculation, whether it happened once or has been happening for months, make an appointment with a urologist. Not next year, soon. A thorough history, a physical exam, and a few simple tests are typically all that's needed to arrive at a clear diagnosis. Knowledge is the first and most powerful step out of fear. 2. Manage the conditions that feed the problem. High blood pressure, diabetes, elevated cholesterol. These are not just heart concerns. They directly affect the vascular and nerve health that controls every aspect of your reproductive function. Keeping these conditions well managed is one of the most powerful things you can do for your sexual health long term. 3. Review your medications. If you're on alpha blockers or other medications known to affect ejaculation, have an open, honest conversation with your doctor about whether alternatives exist or whether dosage can be adjusted. Don't stop anything on your own, but do have that conversation. You deserve a doctor who takes your quality of life seriously. 4. Break the silence at home. Tell your partner what you've been experiencing. It may not be an easy conversation, but intimacy built on concealment is fragile. Intimacy built on honesty, even about the hard things, is extraordinarily resilient. Your partner almost certainly wants to understand. Give them the chance. 5. Get your testosterone checked. If you're over 50 and haven't had your levels measured recently, this is the appointment to make. A single blood draw. Information that could change your energy, your mood, your desire, and your quality of life. There is no reason to keep guessing when the answer is that simple to find. The last thing I want to leave you with: dry ejaculation is not the end of your intimate life. It is not proof that your best years are behind you. It is not something you have to carry in silence. And it is not something you simply have to accept. It is a message. The men I've watched walk out of my clinic after a real diagnosis and a clear plan. The transformation isn't just physical. It's the way they hold themselves, the relief in their eyes, the quiet return of confidence that shame had been slowly taking from them piece by piece. That is available to you. You are not too old to ask for answers. You are not too proud to ask for help. And you are absolutely not past the point where things can get better. I have watched men in their 70s reclaim energy, intimacy, and joy that they were convinced was permanently behind them. Your body still responds, it still adapts, it still has far more to offer than fear has been letting you believe. One honest conversation, one doctor's appointment, one blood test, that's all it takes to set something in motion that could genuinely change the next decade of your life. You deserve that. Your partner deserves that. Your life deserves that. I'm Dr. REENA. Thank you for trusting me with something this personal today. If this video gave you even one moment of clarity or relief, please give it a like. It helps this message reach the men who need it most. Subscribe so you never miss these conversations. And leave a comment below. Tell me where you're watching from, tell me what resonated, tell me what questions you still have, because that's exactly why this community exists. So no man ever has to figure this out alone. Take care of yourself. You've earned every good year still ahead of you.